Hi everyone, Dr. Emmy from Pain Free and Fit and Posturesize. Today we've got part 3 of our ongoing series in terms of how to design your own home or gym exercise program for spondylolisthesis without hurting yourself. Today in part 3 we're going to be talking about the 8 biggest mistakes to watch out for when exercising to avoid aggravating lower back spondylolisthesis pain. So by far, the first and most common mistake that most people with spondylolisthesis make when it comes to working out or exercising and designing their program is a lack of tailored custom stability for their spondylolisthesis. When that spondylolisthesis segment slides forward, there's various mechanical stresses that go onto it based on what your natural posture tendencies are, what your movement habits are. Almost every single client that I've trained and patient that I've helped with spondylolisthesis has some type of posture mechanical stability problem, whether it's a tendency to hip hike, raise a hip with certain movements, have a leg that turns out to one side causing hip hiking, have a tendency to twist more with their pelvis or their rib cage to one side than the corresponding body region, whether it's overactive erector spinae muscles and underactive glutes, whether it's weakness in the abs in terms of tilting the pelvis upwards so we have a level pelvis and our pubic bone and tailbone is horizontal, whether it's a problem with the deep erector spinae muscles that they can't contract enough to hold that spondylolisthesis segment back. Having proper stabilization is as unique for you with your spondylolisthesis as it is for me or any other person. We all have our unique problems. If you haven't yet done so, go to the Pain Free and Fit or Posturesize.com website, take the free body analysis there, learn out what your unique posture and mechanical issues are so you can hold these corrections, learn how to correct them. We have other videos on our channel here that go over some of these ideas, but make sure that you're holding your spine stable at your spondylolisthesis segment based on unique mechanics and posture tendencies. The second most common problem with spondylolisthesis and exercise is an increased arch in the lower back with horizontal or prone exercises. Exercise position when you are horizontal, such as when doing push-ups, planks, when you are doing bent over rows, when you're doing kneeling rows, exercises such as horizontal squats, bar thigh slide rows, whatever you're doing where the torso is forward, and especially when it's horizontal, the back, because of gravity, wants to arch. The belly wants to drop and the lower back wants to arch. And this is going to drive that spondylolisthesis vertebra more forward. It's going to create compression and irritation in the back of the spine as it extends. So in this position, the key is keeping the tailbone tucked under and the front of the rib cage hunching down or crunching down so you maintain that neutral spine position. Without the correct abdominal tension, the lower abdomen is going to sag, we're going to arch the back, and we're going to be much more likely to irritate that spondylolisthesis pain. The third most common problem that people make with spondylolisthesis pain while exercising is in overhead motions. Whether you're pressing or whether you're pulling, there's a tendency for the torso to lean backwards. The rib cage should be held in a neutral position both while pressing and when pulling. When we have a tendency to lean backwards, especially if we're doing shoulder press or any type of military press, as the pecs get weak and the shoulders try to take over, we try to lean backwards. It allows our pecs now to recruit themselves more using less shoulder. The pec is a larger muscle taking pressure off the shoulder. So as we lean back, we get a better mechanical advantage using more of the upper pec. The further we lean back, the less shoulder we have, the more pec it is. And as we grind out those last few reps, we rely on this tendency to lean back to press overhead. Happens with dumbbells, barbells, kettlebells, bands, whatever you're doing where you're pressing overhead. We need to counter this by keeping the rib cage crunched down with abdominal tension so that as we're pushing, we're using more shoulder than upper pec. That helps to decrease the tendency to lean backwards and arch the lower back. As we reach overhead, we're also stretching the latissimus muscle, which runs from our shoulder down to our lower back. If those lats are tight, which they are in many people with spondylolisthesis, the higher that we reach, the more that lat stretches, the more it pulls on the lower back and creates that same extension. So whether you're doing pressing overhead, whether you're stretching, whether you're doing yoga poses with the arms overhead, the higher that the arm comes, we need to counter that with the same tension of the abs, keeping the torso down so we counter the effect of having a lower back arch. We also keep a little tailbone under, which helps to decrease that tendency to overarch. When we're doing lat work, pulls, it could be chins, it could be pull-ups, it could be lat pull-downs on the machine. It could be chops that we're doing, diagonal chops, rehab exercises. Anything we're doing where we're pulling down from above, the same thing. The lat muscle is stretching, it's contracting strongly. As it contracts, it naturally, mechanically, because it attaches to the thoracolumbar fascia of the lower back. Once that lower back to arch, we need to counter that with tail under and abdominal tension down, holding our body in a neutral position. If we're doing one arm pulls, we need to also make sure that we're not hip hiking or side leaning. The problem with a one arm pull for a lot of people with spondylo is that as they get to the motion where it's tough and they're going for their last few reps, as opposed to using the lat correctly and the stability muscles correctly, they'll have a tendency to either hip hike, raise the hip on that side, or lean in to finish the pull. If you're doing that, you're compressing that side of the spine, compressing facet joints, disc fibers, and stretching the opposite side, capsules of the facet joints, ligaments and muscles, many times leading to injury. So keep the pelvis and the rib cage level with unilateral pull exercises. The fourth biggest mistake people make with spondylolisthesis and training is extension of the lower back due to extension of the neck during the squatting motion. When we squat down, and it could be during a squat exercise at the gym, it could be bending down at home to do something, it could be bending at the dumbbell rack to pick something up. As we squat, if our eyes are not following the same direction that our chest points, and instead, if our eyes look upwards, as we extend our neck, there's a reciprocal extension of the lower back, many times aggravating spondylo. So get in the habit of squatting, of keeping your eyes and chest always pointing in the same direction. That'll help you keep a neutral spine in the lower back by keeping a neutral lordotic curve in the cervical spine. The fifth most common mistake people make with spondylolisthesis and exercising is during hip extension, when the hip comes behind. Many times, because spondylolisthesis is associated with tight hip flexor muscles in the front that lead to an anterior pelvic tilt, thus compressing the lower back and aggravating spondylo, what we need to do is make sure we have the appropriate muscles working. Typically with an anterior pelvis, we have overactive lower back muscles, the erector spinae, in their ability to extend and aggravate the spine, and weak buttock or hip extension muscles. So what we want to do is we want to make sure we keep a pelvic tilt where we posteriorly tilt the tailbone under and pubic bone up. That engages our abs, and it allows us to recruit more glute muscles when we're walking and pushing a leg behind us, when we're lunging or split squatting with a leg behind us, when we're performing low band or low cable hip extension exercises. It's all the same. As the leg comes backwards, even reverse hypers, when you're laying face down or raising your legs up for glute work, or glute bridges. As the leg comes behind you, we want to counter that with tail under tension to release some of those hip flexor muscles, better recruit the glutes, which then dynamically changes that imbalance between erector spinae and glute activity. It releases the tight hip extensor muscle compensation in the lower back erector spinae muscles, and it activates or wakes up the weak buttock. So as we do that, we're going to focus on squeezing the butt as the leg comes behind us with tail under, so we're feeling more abdominal and glute tension. That decreases the ability to overarch the back. And if we accentuate a posterior backwards glide of the hip joint, we've talked about this in other videos, with the side of your hip, you want to make sure that that hard ball of the greater trochanter moves backwards into your finger. That will help to release the hip flexor overactivity as well as the leg comes behind in hip extension. The sixth most important idea when trying to protect yourself from injury with exercise during spondylolisthesis is during abdominal training. Most people with spondylo emphasize too much crunching down with the rib cage and not enough tail under or posterior pelvic tilt. This can be seen in exercises like curl-ups and crunches, where we're laying down and we're trained to sit up with our rib cage or our head, but we fail to emphasize the greater need to posterior pelvic tilt, which is usually indicated in most cases of spondylolisthesis. This includes not only slight curl-ups, but also full crunches, full sit-ups. It also includes exercises like front planks. When you're holding a plank position, 90% of that effort for most of the people with spondylo should be in the tail under, posterior pelvic tilt, and just 10% with the crunch down with the rib cage in order to develop the abs. Same thing if we're doing TL hip rotation pulls, with a cable against our chest and slowly rotating as we hold tail under tension and crunch down using the abdominals, keeping our nose, our belly button, and our pubic bone aligned. Most of that effort should be in maintaining the tail under, not in the crunch down. We can also extrapolate that into a standing pull-down exercise, which we've shared on this channel for the abdominals, where we're training the lats and the chest and the arms, pulling the arms straight down. 90% of that effort in terms of holding our core should be in the tail under department and not in the rib cage crunching down. That allows you to train the more needed motion of keeping the pelvis in a neutral alignment, level pelvis, tailbone, and pubic bone, as opposed to crunching down in slumping posture during the day. That's going to positively affect most people with spondylolisthesis. The seventh biggest mistake that people with spondylo make is leg raises. This is one of the worst exercises for people with spondylolisthesis. Whether we're doing bilateral exercises with both legs, whether we're doing single leg lifts, whether we're doing Pilates work in circles, or whether we're hanging from a chain bar, every time that leg comes forward and flexes, it has a tendency to accentuate that curve in the lower back. The iliopsoas muscle attaches directly to the spine that's involved with hip flexion, and many of the hip flexor muscles attaching to the pelvis will cause an anterior pelvic tilt, thus increasing that arch in the back and aggravating spinal problems with spondylolisthesis. So with your abdominal work, look more for static exercises such as bird dogs, such as straight-legged curl-ups, such as planks, front, side, rotational planks. We have a plethora of abdominal exercises on this channel you can check out, all much more effective at training the abs to hold the spine in a neutral position rather than leg raises, which often decrease that pelvic neutral alignment, increasing the pelvic tilt, anterior tilt, and increasing the arch, which injures spondylolisthesis sufferers. And the eighth most common mistake people make with spondylolisthesis while exercising that hurts them is exercise sequence. Always keep in mind what your unique distortions are. If you have the tendency to side tilt with your torso and your RPI, you know you need to keep that torso up. You want to do any type of work like side planks, where that side is down, with cliff hangers, where that side is up. Anything where it is going to lean you into distortion, you want to do that side first and do the opposite motion last in the sequence so your body's left in a corrected state. If you have a tendency to turn your leg out on one side and hip hike on that side, anything that's going to contract your body, leaning side pulls with TL lateral flexions, with standing hip abduction exercises, you want to do that side first and then leave yourself in a corrected state by contracting in the opposite way so your body's left in a corrected state. Typically, people with spondylolisthesis have tight hip flexor muscles. So any activity we do where we're bringing our leg forward, where the leg is in a forward position, let's say you have a tendency to be tighter in your right hip flexors, you'd want to do split squats or lunges with that leg forward and end the sequence with that leg back so you're leaving the body in a corrected state. Typically with spondylo, if you have tight hamstrings, you're going to do hamstring work first, and you're going to leave the body with quad work, like leg extensions last. If you have tight hip flexor muscles, you want to do any activity where you're forward planks, crunches, going back and forth with any type of bird dog or knee to elbow motion. You want to do that first and leave the body in a corrected state with the leg back. Any type of abdominal work, you want to make sure you do that last after spinal extension work. If you're doing things like horizontal squats with your arms out, that's extension work, but you're also tightening the hip flexors. So you want to end that with the leg back, stretching out, or doing things like hip extensions or glute activation or low leg pulleys with your leg going back and out. So you're stretching the tight hip flexors. So always think specifically in terms of your tailored needs. Whatever your distortion pattern is, you want to do that exercise or that movement or position first, and you want to end with a corrective exercise so the body's left in a corrected state. Keeping these 8 steps in mind, not only when you're designing your own home workout program or gym workout program, but also when performing your exercises, will go a long way to helping you prevent aggravating your spondylolisthesis low back pain. I hope this video on spondylolisthesis and how to build an exercise program to reduce pain helps you with your spondylolisthesis pain. If you'd like to learn more exercises and more about training with spondylolisthesis, feel free to subscribe to our channel. We have a lot of great videos to help you that are out there. If you'd like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great tailored exercise program for your spondylolisthesis to help you analyze your biomechanics, find out what your neutral spine is that's specific for your body, how to strengthen your ability to maintain a neutral spine so you're less likely to feel pain, and get back to the physical activities you want through coordination, strengthening, and balance exercises, look no further than our Fast Track program for spondylolisthesis pain, available at the painfreeandfit.com website, as well as contacting me if you'd like me to work with you in setting up an individualized program. I hope this series on spondylolisthesis designing workout programs helps you in your quest to live pain-free and fit.